Welcome back to Inside City Hall. We're returning now to tonight's top story. First Lady Chirlane McCray testified before the City Council today about the mayor's much talked about mental health initiative, Thrive NYC. Today's hearing comes as the program has faced growing scrutiny over whether it has been effective and whether the money has been spent wisely. Joining me now to talk about this, we have two experts. Carla Rabinowitz is the advocacy coordinator for Community Access, which provides support to the mentally ill. And DJ Jaffe is the founder of Mental Illness Policy Org and also the author of Insane Consequences: How the Mental Health Industry Fails the Mentally Ill. Thank you both for being here. And I know you had a long day. You were both at City Hall during this hearing. Carla, I want to start with you. What did you make of the First Lady's testimony and the answer she gave about whether her program is working? Were you satisfied with what you heard?
So first, there's been a lot of talk about how Thrive is not focusing on the severely mentally ill, right? And I disagree with that. Community Access runs two of Thrive's intensive care teams where there's like one worker to 3 people and one worker to 7 people. It's for getting people on the streets, people been cycling in and out of hospitals, building relationships, getting them into care. Also, more importantly, for the vast majority of mental health recipients, a crisis can happen anytime. So Thrive is there when they say to help prevent people from getting into crisis. It's a process, right? People I know, they get sick once a year or once every few months, and they'll have ways to get around, and they call that New York City well line. I think there were 250,000 calls.
DJ, what did you feel similarly? I know you've raised concerns that the program is not focused on the seriously mentally ill.
And I think she proved that today. In fact, one of the council members asked her, said, how much is focused on the seriously mentally ill? And she said all of it. And I think the audience tittered when they heard that. Her director of strategy had previously told the Staten Island paper that $165 million out of the $850 million budget was on the seriously mentally ill. We did an analysis this weekend and we found at most 34% focused on the seriously ill. I was kind of shocked by how little she knew about mental illness. She said that you can't count them. Well, there are counts, and the counts are that there are 239,000 people with serious mental illness in New York. 93,000 get 0 treatment. That's the elephant in the room. How do we get treatment to the untreated seriously ill?
So how do you do that? How do you reach that population that many would argue is most in crisis, Carla?
So through many different ways, right? These IMT teams at Community Access.
What is an IMT team?
So it's an intensive management team where there's very few people for one worker. And they go and they make contact any way they can with a person on the street. Get them a pair of socks, get them some coffee, build up a relationship, and then you can get them into care. But I still want to stress that the problem with this philosophy is you're thinking that there are these severely mentally ill, and then there's everybody else who's functioning. And it just doesn't work that way, right? I'm an attorney, I own a co-op, but I live with manic depression. And at any time I can get sick. And of those 250,000 calls to Thrive, maybe a lot of people who called a lot of different times who are on the brink of going into a crisis. So I feel that everyone who has a mental health diagnosis, you know, is like one step away from a crisis. And these kind of services to prevent a crisis are very important. And then these IMT teams and programs like that, short-term employment training programs that might not really lead to employment, but give people something to do, connections to a clubhouse. These kind of things are important.
So what you're saying is echoing more what we heard from the administration today. That's been the First Lady's argument, is that you want to reach people before they become seriously mentally ill. So there's some disagreement here at this table about how to handle this.
Well, that in particular, she keeps billing this as a prevention program. The reality is schizophrenia and bipolar, which make up the bulk of the most seriously mentally ill, can't be prevented. There will be a Nobel Prize to whoever figures it out. But she's billing this as a prevention program, and it's simply a fact-free way to describe it.
So I want to ask you about people, many New Yorkers anecdotally, and we're also seeing an increase in the number of 911 calls with New Yorkers reporting to the police. or to the authorities, an emotionally disturbed person. When people encounter someone that they feel is seriously mentally ill, whether it be on the street or on the subway, what should a New Yorker do?
They should call New York City Well and ask for a co-response team. There aren't that many of them right now, but there are 10 cars of a social worker and a very well-trained police officer. These are the huggable police officers. Call New York City Well, ask for a co-response team. They can be out there like in an hour.
In an hour, though, but if you're on the subway, I mean, you're moving from point A to B.
Yeah, and in an hour we have people calling and they're told to wait, that there won't be a team to get to them for 2 days, and they're being told to call 911. There are homeless, psychotic, delusional people living on the streets. As a kind and compassionate society, we have to start helping those who need help the most, not the least. We have to send them to the head of the line rather than jails, shelters, prisons, and morgues. And the First Lady seemed clueless that this problem even existed. She saw no need to prioritize any population. She mentioned anxiety and depression about 20 times, never once mentioned schizophrenia, never once mentioned bipolar, never once mentioned psychotic, delusional people.
There are plenty of people with schizophrenia and manic depression who are functioning but are still one step away from a crisis, and that's important, and there are large numbers. Yes, there are homeless. Yes, we need supportive housing. Wouldn't it be great if the city had like a 24/7 therapist who can come out instead of a police pre-crisis? There are some alternatives to like a 911 call. Maybe the New York City Well could do stuff like that. Community Access is having a rally next Thursday, April 4th at noon to call on like non-police alternatives and more crisis prevention things like an urgent mental health care center. So there are more things that can be done.
Carla and DJ, thank you so much for being here and talking about this important issue. We really appreciate it, especially after a long day at City Hall. It's time now for a break.